Thank you for joining. And I'll just take a minute to do a little bit of housekeeping and introduce myself. I'm Diane Caraggio, the Chief of Staff for the Lerner Center for Public Health Advocacy. Unfortunately, our director, Shelley Hearn, couldn't join us today. She's not feeling well, but she's obviously very supportive and very excited about all the interest so far. So just a couple of reminders, you can access this information. We'll be recording this session, so you can access the recording after today. So we'll get that posted on our website in the coming days. If you have any other colleagues that want to watch but weren't able to attend. Also, a lot of the information that we will go over today in today's session is on our website. So you can access that on our website in the opportunities section. A lot of this information was also in the newsletter, and you can also reach out to us directly. I'll have my contact information at the end. And it looks like Amber Ray just added the website into the chat, so thank you for doing that. And all the information is there, except for some of the questions that we'll receive from the group today. So I am going to get started. Hopefully you can see my screen. So just a little bit of context, we have talked about this in some of our communications, like in the newsletter, but just to give you a little bit of background about how we got here and how we came to the award. In 2018, the school and Dean McKenzie made an unparalleled commitment to advocacy, and it was added to the strategic plan as an important pillar of the school's plan for the next 5 to 10 years. So that was very exciting. That was shortly after the Center for Public Health Advocacy was started, and around the same time that we saw advocacy appear in the strategic plan, Sydney Lerner, who passed away in 2021, and his wife, Helene Lerner, gave a few generous gifts to get that ball rolling. So one of those was to support the center and Shelley's professorship, the professor of practice. But another one of the gifts was to get the ball rolling on this award. So this was very exciting, and this was to help us see the culture of advocacy as we build out the commitment that was made in the strategic plan. So the goals of the award, or the objectives of the award, are a couple things. So first is, as I said, we are looking to elevate the importance of public health advocacy and really cement it as an important part of public health practice. So that's the first objective. The second objective is to recognize and reward past achievements. So that's where the Achievement Award comes into play. So we're kind of looking backward at some of the work that has already been underway. And then Objective 3 is to support and encourage future public health advocates. So Objective 2 aligns with the Achievement Award, which is what we will be spending most of our time talking about today. And then Objective 3 is really aligned with the Impact Awards, which will happen in the future. We'll touch on a little bit today, but we're really here to focus on the Achievement Awards. So as I said, we're going to focus on the Achievement Award today, but if you have questions about the Impact Award and if it's appropriate, we can go over that. But just a little overview here of each of the different awards. So the Advocacy Achievement Award is the $100,000 award, and that again goes to reward and recognize past achievements in public health advocacy, and that will go to one faculty member. The faculty member has to have a primary appointment in the Bloomberg School of Public Health. So we have many joint appointments, but they have to have their primary appointment in Bloomberg. And the award is open to anybody with a primary appointment except for faculty with an instructor, adjunct, or visiting title. So happy to answer more questions about that. Well, I'll come back to the judging panel, but the Impact Awards, we will give away 2 of those, and those are each $40,000, and those will be awarded to 2 early career faculty members. So again, they have to have a primary appointment in the Bloomberg School of Public Health. Again, this excludes faculty with an instructor, adjunct, or visiting appointment, but it also excludes senior scientists and full professors. So we are looking for anything up to senior scientist and full professor. So a little more information about each of the awards. So the Advocacy Achievement Award, $100,000 is a large award, and we expect some of that money to be used to enhance the next generation of public health advocates. So this is a general guidance, and to give you a few ideas, and it's not limited to this, but part of the funds can be used for things like practicum internship opportunities, funding educational opportunities for the next generation of public health advocates, mentoring opportunities, support for postdocs, things like that. So again, those are just a few examples, but it is not limited to that. And we will probably talk about this later, but we are not going to specify exactly how much of the $100,000 needs to go to next gen activities. We'll come back to that. So another thing to note with the impact awards, in addition to the monetary award that the junior faculty receive, they will also receive communications training, support from other faculty in the school, strategic support, and mentoring. So this slide is to address what is on the nomination form. So these are the categories on the nomination form. This directly reflects, if you haven't already visited the nomination form, this directly reflects the categories and questions that you will be asked to complete when you submit your nomination. So in addition to these 5 questions or 5 criteria, you're obviously also required to submit information about the nominee. So that could either be yourself, or that could be the person that you are submitting the nomination on behalf of. And that will include faculty appointment, department, things like that. So one thing to note, you can nominate others for the Achievement Award, or you can nominate yourself. That will not be the case for the Impact Awards that will be happening in early 2023. Those have to be self-nominated by the individual who will receive the award. So these 5 criteria are also directly reflected in the rubric that the judges will be using to measure the nominations. So it is a mirror image of one another. They will be looking for the answers to these exact questions. Okay, so a little bit of an overview, just mostly a review on the timeline. Open nominations, well, nominations are open now. September 14th is when they opened, and they'll go through October 14th. And that just means that the nomination form is open, and you can feel free to submit questions to us during that time. In mid-October, the nomination form will be closed, the site will be closed, and from there, the staff at the Lerner Center for Public Health Advocacy will be working with the judges to narrow down to about 3 to 5 finalists, depending on the level of submissions that we get. And then the judges will ultimately be responsible for identifying one single winner. And so all of that process will be going on in the background from about October 17th through November 18th, just before Thanksgiving. And it's possible that if you are selected as a finalist, we may reach out to finalists for a little bit more information, some supporting information, or to clarify things in the nomination form. That does not mean, if we reach out, that does not mean that you are the winner. It just means that, you know, you're a top contender and we just want a little bit more information. The winner will be notified by December 16th. And there was something else I was going to say about that, but I'll come back to it. And then when we announce the winner, it will be around January, February. So we're hoping to announce the winner in January of 2023 to the Bloomberg School Public Health community. And then we will host an award event in February of 2023. And then around the time that we host the event, to make the announcement and host the event for the winner of the Achievement Award, we will also be opening the nomination period for the Impact Awards. So that is all the information I have. I know that was quick, but I wanted to leave enough time for questions, comments. So if anybody has any questions, you can drop them in the chat. Amber Ray Davidson is our wonderful communications person. She's on the call, and she'll be sharing some of the questions in the chat with us.
Yeah, thanks everyone for attending. We do have a few questions lined up here. First one is, when will funds for the awards be dispersed?
Okay, to repeat the question, when will funds for the awards be dispersed? So again, for the Achievement Award, we won't get into the Impact Award, but for the Achievement Award, the funds will be dispersed in January of 2023, January to February 2023. I can't give an exact date, but that will look like there will be a process where we will work with your department, the winner's department, to create an account within their department in order to move the funds. So that will happen between January and February of 2023.
Awesome. Another question coming through: what portion of the funds should be used towards the next generation activities? And I know you mentioned it briefly earlier, but maybe if you could expand on that.
Yeah, good question. It's a question that we get a lot. So again, we are not going to specify exactly what portion of the funds need to be used for next generation activities. So as experienced senior faculty, we trust your judgment and how the funds will be used to benefit future generations of public health advocates. And so because this isn't a grant, there isn't an expectation of detailed reporting. So that said, there will be expectations and opportunities for the winner to share their progress with us and the Bloomberg community. So, you know, just know that people will be looking to you to share how you're using those funds.
Great. One question that we did receive ahead of time was an inquiry about an opportunity for joint nominations. So, you know, more than one person submitting themselves for the Achievement Award.
Yes, that is also a good question. So we will not, we discourage people from submitting joint nominations, but we won't stop anybody from submitting a joint nomination. It will ultimately be up to the judges to decide. And the winner, so in order to encourage people to submit a single nomination, I will say that the winner can share funds with close collaborators as they see fit once they receive the award, and they can obviously credit any collaborators in communications once they win. So there will be a lot of interesting opportunities for the winner to talk about their work. We hope to have them featured in the magazine, in the school's magazine, and other communications, our website, newsletters, things like that. So there will be ample opportunities to give credit where credit is due.
Great. Are there any other questions? Please feel free to share them in the chat. Give everyone a second.
Yeah, so while we wait for other questions, some additional context that maybe I should have covered in the beginning. So we hope to expand this award in the next couple of years to all schools and programs of public health. So right now, this is just the Hopkins community. And we decided that we should really get our culture of advocacy and get our ducks in a row before we expand it out to other schools. So this is the first year. We will probably do it internally for about 2 to 3 years, and then we hope to expand this to other schools. So I think it is exciting for the winners to be among the firsts once we expand this to a broader audience. Do we have any other questions in the chat?
We do have someone who has raised their hands. I'm going to allow them to talk.
Okay, thank you.
Is there any, are there any guidelines for who nominates? Are you thinking about a variety of nominees, or all within the School of Public Health?
You're saying who submits a nomination?
Yes. Can outside nominate people within the School of Public Health? Partners,
yeah.
other, collaborating colleagues, or do you want this restricted solely to the JHSPH family?
That is a great question. Thank you. So for this first year, we will restrict it to just the School of Public Health. That said, it could be faculty can submit a nomination for another faculty, or staff can also submit for a faculty member. But for now, we will keep it in the Hopkins community. But in the future, that is something that we will consider as we broaden our scope. Thank you. Is there anything else in the chat? I don't know if anybody else wants to raise their hand and ask questions. Okay, well, that was extremely quick. So again, you can reach out to me directly. You can send me an email. I encourage you to visit our opportunities page on our website. And another great way to stay in touch is to sign up for our newsletter. We will be sharing a lot of information via the newsletter over the next couple months. And then once the award is over, it is also a great way to get information about the center. So definitely encourage you to do that. Follow us on Twitter. We also have a lot of information there about the award. We feature some additional information about the judges, and the judges are also in our newsletter and on our website. So would encourage you to visit those channels, and happy to answer any other questions or field questions over email. So if we don't have any more, then I think we will end it here. And again, this will be recorded and you can find it on our website if you have any other colleagues that weren't able to attend. Thank you.